Hello everyone, a very good morning to all of you. So today let's talk about a very important and most frequently asked topic in OMFS, that is LEFORT fractures. Okay. So before moving into the actual path or actual trajectory of these LEFORT fractures, I'll be talking about a few very important landmarks. So once I tell you the landmarks, you are going to tell me what are all the structures it is involving in LEFORT 1, 2 and 3. Okay, so with this video you are not going to get any confusions or doubts in LEFORT fractures, and without further delay we are moving into the topic. So this very big structure which you see here is the frontal surface of the skull. Okay, so what you see here is the very important bones which is going to get involved in the LEFORT fractures. Okay, so the red structure what you see here is the maxilla. See, pay very attention in these landmarks, because if you don't know these landmarks, whatever terms I'm going to tell you, it will be very confusing for you. So this red structure is the maxilla. This is mandible. And the yellow structure what you see here is the nasal bone. And the violet structure what you see here is the lacrimal bone. Okay, so lacrimal, nasal, maxilla and mandible. Okay, very basic landmarks in osteology. Now another important landmark what I'm going to tell you is the pterygomaxillary junction. Okay, so the pterygomaxillary junction is a very important landmark in LEFORT fractures, because in almost all the three LEFORT fractures 1, 2 and 3, this pterygomaxillary junction is going to get fractured. Okay, so pterygomaxillary junction. So in almost all the three LEFORT fractures, pterygomaxillary junction will be fractured. Okay, now moving on to the another few important landmarks. Okay, so this is the nose. Okay, and this is the orbit. Okay, so a suture which is present here is the frontonasal suture. So this part, frontonasal suture. So along that you see another suture. This is called as frontomaxillary suture. Frontomaxillary suture. Okay, so you know what is frontonasal suture, frontomaxillary suture, and this is the orbit. So this surface of the area is called as the medial wall of the orbit. And the prominent structure, if you touch here, you can feel the bone, right? This is the infraorbital rim. Okay, orbital rim. And if you palpate inside the infraorbital rim, there will be a very fragile area. Okay, that is called as the floor of the orbit. Okay, so frontonasal suture, frontomaxillary suture, and then the infraorbital rim, and then inside the infraorbital rim, if you touch, it will go it will be very fragile area, that is the floor of the orbit. Okay, so this is the lateral wall of the orbit. Okay, medial wall, lateral wall, floor, infraorbital rim, frontonasal, frontomaxillary sutures. Okay, fine. Okay, now I'm going to tell you a very important landmarks in the LEFORT fractures. Okay, so first one is LEFORT 1. So in the LEFORT 1, just put your pens down and just listen. In the LEFORT 1, the fracture is going to run from the apices of the maxillary tooth. Okay, so from the apices of the maxillary tooth, it goes along the floor of the nasal cavity. It goes along the floor of the nasal cavity, along the lateral wall of the maxillary sinus, and it is going to end in the pterygomaxillary junction. Okay, apices of the maxillary teeth, floor of the nasal cavity, lateral wall of the maxillary sinus, pterygomaxillary junction. So with this fracture, what it does, it cuts off the alveolar process with the midface. Okay, so this portion, this entire portion is going to be mobile. So this is called as maxillary mobility test. Okay, these patients will have this segment completely detached, it will be mobile. Okay, that is why it is called as floating palate. This fracture is otherwise called as floating palate or Gurion fracture, whatever you pronounce. Okay, so the maxillary alveolar process and the palate is completely detached. Okay, it moves as a fragment. How to test it? Hold the nasal bridge on the forehead and you move, this portion alone will move. So in LEFORT 1, what is the landmarks? Apices of the maxillary teeth, and then it flows along the floor of the nasal cavity. It moves along the lateral wall of the sinus, ends in the pterygomaxillary junction. It completely detaches the alveolar process palate with the middle face. Okay, floating fracture or Gurion fracture. Now I'm going to write whatever I told. Okay, so what is it? Apices of the tooth. It goes along the apices of the tooth, and then the floor of nasal cavity, and then it goes to the lateral wall of sinus. It comes to the pterygomaxillary junction. So this is LEFORT 1. Okay, so very simple, right? Since we have learned the landmarks, it becomes very easy. Okay, so apices, floor of the nasal cavity, lateral wall of sinus, pterygomaxillary junction. This is called as floating palate or Gurion fracture. Okay, why? Because the upper segment, that is alveolar process, and the palate is completely detached. It is movable. Okay, now you are going to tell me what will be the clinical features. See, it passes along the floor of the nasal cavity. Can I expect bleeding, epistasis? Of course. Why? Because we are going to see anastomosis of some major arteries there. Okay, so clinical features of LEFORT 1 will be epistaxis. Okay, why? There will be anastomosis of anterior ethmoidal artery, superior labial artery, greater palatine artery, sphenopalatine artery. So these major arteries, they are going to anastomose here. So obviously these patients will have bleeding. Next, very, very important landmark. There will be anterior open bite for these patients. Anterior open bite. Why? Because, see, the segment is completely detached. The muscles will pull it downward and superiorly. So when I pull it downward and superiorly, the mouth will become opened. So these patients will have most commonly anterior open bite. Okay, so the two important clinical features what we have seen is epistaxis, that is because it passes through the floor of the nasal cavity, there will be bleeding. Anterior open bite will be seen. Okay, and the very important clinical feature, another one is maxillary mobility test, that is these patients will have this segment of the alveolar process and the palate will be mobile. So three important clinical features seen here. So LEFORT 1, if you see, it generally, if the fracture is, it is not displaced that much, minimal fracture, or if the occlusion can be stabilized properly, okay, and there is no commuted fractures, there is no major change of occlusion, then I can go for closed reduction. Okay, otherwise I have to do open reduction. I'll talk about what is closed reduction, what is open reduction at the end of this video. But as of now, you know that LEFORT 1, closed reduction, if there is no major fractures, if the fracture segment are stable and the occlusion can be obtained perfectly. Okay, closed reduction. Otherwise we can go for open reduction. Okay, before moving into that, first we have to plan the patient. If the patient comes with a LEFORT fracture, we have diagnosed the clinical features, we have identified the patient as LEFORT 1. Now what you should do is, first you should treat the patient as an emergency. So you should control nasal bleeding. So first one is treat the emergency. So you should control bleeding, IV fluids, secure airway, and then give analgesic antibiotics, tetanus injection. This should be the emergency treatment for all the fractures, LEFORT 1, LEFORT 2, LEFORT 3. Control bleeding, IV fluids, and secure the airway, analgesic antibiotics, and TT injections. Okay. Next step will be, once you secure these patients, you can go for either closed reduction or open reduction, as I said, depending upon the situation. Okay. I'll talk about what is the procedures done in the end of the video. Okay. So in the LEFORT 1 fractures, you can radiographically see that there is a fracture involving the pterygomaxillary junction and the apices of the tooth. Okay, this is about LEFORT 1. Okay, the fracture runs along the apices, floor of the nasal cavity, pterygomaxillary junction. These segments become mobile. Because it passes through the floor of the nasal cavity, patient will have bleeding and there will be anterior open bite because the muscle pull or the gravity displaces the maxilla downwards and superiorly. So these patients will have open bite. So the patient will tell you that I cannot close the mouth properly after the trauma. Okay, we can suspect it is LEFORT 1 fractures. So this is about LEFORT 1. Okay, so now moving on to LEFORT 2. LEFORT 2, if you see, the fracture passes along the frontonasal suture. It passes along the frontomaxillary suture, passes along the medial wall of the orbit, passes along the floor and the infraorbital rim, and then it process along the infraorbital foramen, and then it goes and attacks the pterygomaxillary junction. And landmarks are very clear, right? Passes along the frontonasal suture, frontomaxillary, then it moves along the medial wall of the orbit, infraorbital rim and the floor of the orbit. It comes down like this, touches the infraorbital, damages the infraorbital foramen, and then goes to the pterygomaxillary junction. This is LEFORT 2. Okay, so it is like a pyramid, right? It is like a pyramid. This is called as pyramidal fractures. Okay, again, LEFORT 2, frontonasal, frontomaxillary. Okay, it moves along the medial wall of the orbit, infraorbital rim, orbital floor, and the infraorbital foramen. It moves along the pterygomaxillary junction. Okay, lateral wall of the sinus, pterygomaxillary junction. So this is the pathway of LEFORT 2. Since we have known the anatomy, it becomes easy. Now what I'm going to write the pathway. Okay, so it runs from frontonasal suture, frontomaxillary suture, and then it goes along the medial wall of the orbit, and then the infraorbital rim or inferior orbital rim, floor of the orbit, and then it goes to the infraorbital foramen, lateral wall of sinus, and then finally into the pterygomaxillary junction. Okay, so imagine this fracture is like a pyramidal fracture. So what happens? There is going to be mid-phase mobility. Okay, so the movement of the mid-phase is going to take place. Now, what is the important clinical feature you can see in LEFORT 2 fracture? There will be epistaxis, as in LEFORT 1, and the very important feature what you see here is there's going to be periorbital ecchymosis. And because of the damage to the infraorbital foramen, there's going to be numbness of your upper lip, the lateral wall of the nose, and the infraorbital rim. So these areas are going to become numb and the periorbital ecchymosis can be seen. Okay, so this is the major features of LEFORT 2. Okay, so how to treat? Again, you can do open reduction and internal fixation can be done. Okay, this is about LEFORT 2 fractures: frontonasal, frontomaxillary, medial wall, infraorbital floor, and then it goes to the zygomatic lateral wall of sinus, and then the pterygomaxillary junction. Okay, LEFORT 2 pyramidal fractures. Okay, now moving on to LEFORT 3. Okay, so LEFORT 3, it is going to result in entire displacement of this mid phase to the frontal bone and the base of the skull. this portion of the face is going to get entirely dislodged or displaced from the frontal bone and the base of the skull. Okay, so craniofacial disjunction will be here. Okay, so in LEFORT 3 there's going to be craniofacial disjunction. Okay, now you're going to tell me the landmarks. Frontonasal, frontomaxillary, which is followed by the medial wall of the orbit, and then it moves along the floor of the orbit, it moves along the lacrimal bone floor of the orbit, and then it passes to an important structure here, which is nothing but the frontomaxillary suture. Okay, this is frontomaxillary suture, and then it moves along important structure called zygomatico-maxillary suture. What is this suture called? Zygomatico-frontal suture. And then this fracture line moves along the zygomatic bone, cuts the zygomatic bone, and it fractures the pterygomaxillary junction. Frontonasal, frontomaxillary, medial wall of the orbit, lacrimal bone, floor of the orbit, and then it passes along the zygomatico-frontal suture, breaks the zygomatic bone, and breaks the pterygomaxillary junction. So this is going to result in complete disjunction of the middle face to the frontal bone and the base of the skull. Okay, so in LEFORT 3, can I see nasal bleeding? Of course I can see nasal bleeding. And one of the very important feature of LEFORT 3 is there is going to be increased or severe periorbital edema will be seen. So these patients will have panda eyes. Panda eyes or panda eyes, whatever you pronounce. Okay, so because there's going to be severe periorbital ecchymosis, there's going to be presence of panda eyes, you can see. So LEFORT 3, since it causes complete disjunction of the middle face with the facial bone, with the frontal bone and the skull, it is called as craniofacial disjunction. Okay, this fracture is called as craniofacial disjunction. So there can be open reduction and internal fixation. As I told you, any fracture you should treat the emergencies, secure airway, and then you have to give IV fluids, stop bleeding, give analgesic antibiotics, TT injection, which is followed by open reduction or closed reduction depending upon. So predominantly LEFORT 1, as I told you, LEFORT 1 might require closed reduction. Other than that, it will go for open reduction and internal fixation. Okay, so this is about LEFORT 3 fractures. So we have talked about the basic anatomical landmarks. We have talked about what is LEFORT 1, LEFORT 2, LEFORT 3, what are the clinical features you see in LEFORT 3. Now moving on to the treatment aspect, as I told you, there can be closed reduction or open reduction. So closed reduction, what I'm going to do, I'm going to place the arch bars. Okay, I'm going to place arch bars, and then wiring is done. Okay, and then once the proper occlusion is obtained, I'm going to do maxillomandibular fixation. Okay, so once proper occlusion is obtained, I'm going to do maxillomandibular fixation. I'm going to leave for 4 to 6 weeks. Liquid diet. This is closed reduction. This is called as closed reduction. So closed reduction can be done in patients who are having minimal fractures, minimal displacement, fracture fragments are stable, and there's no comminuted fractures. Occlusion can be perfectly obtained. So these patients, you can go for closed reduction. So first I'll secure with arch bars, then wiring should be done. Once the occlusion is obtained, then I should do maxillomandibular fixation, leave for 4 to 6 weeks. Soft diet and oral agent maintenance should be done. So this is about closed reduction. In open reduction, you should give incisions, predominantly vestibular incision or infraorbital incision depending upon the fractures. Okay, then you should do platings. Okay, so for LEFORT 1, the plates are kept in pyriform area and zygomatico maxillary buttress. Okay, and in LEFORT 2, plating is done at frontonasal suture, which is followed by the infraorbital rim and zygomatico maxillary buttress. And in LEFORT 3, plating is done at frontonasal suture, zygomatico frontal suture, and zygomatic bone. This is open reduction and internal fixation. So give an incision. Before that, you should give arch pass and give an incision, stabilize the fragments, obtain occlusion, and then do maxillomandibular fixation. So this is about open reduction and internal fixation. Okay, so we talked about closed and open reduction. This is a treatment of LEFORT fractures. See, LEFORT fractures is one of the very common topics and very important topics as across NEET and INI-CET. So you should know about these fractures, where it runs and what is the treatment and what is the and landmarks it passes through. Okay, so this will form the very base, and you should try to implement few more topics, few more advances in these LEFORT fractures, and you have to build it on. Okay, so I hope this video makes sense. We talked about the LEFORT fractures, the overall view of LEFORT fractures. I hope this video makes sense. So thank you so much for watching the video. Have a nice day.